My name is Roskin, and I work at Duke Physical Therapy. I'm actually second of 12 children, so when I was younger I had an aunt who would pick me up and take me on her rounds in the hospital. She was a nurse. And I was exposed to being in the hospital and really enjoyed it. And then when I was in 10th grade, I took an anatomy class and decided that physical therapy would be a good fit for me. I treat any outpatient orthopedic injuries, people with status post total knee, back surgery. I treat people of all ages, from teenagers to older people, and just working on getting people back to their functional goals and teaching them and educating them about exercise and rehab. I'm certified in manual therapy, so I like to get my hands on people and feel joints and muscles and really work with the patients and educate them a lot on how to get back to what they want to get back to. I think that Duke has wonderful communication between providers. I think that this is something that's lacking in a lot of other healthcare systems. And I've seen, if I have a patient come in who's having a trouble or may need an x-ray or something, it's very easy to connect with their primary care physician or the orthopedic surgeon and immediately get what they need. And since I've been at Duke a long time, I also have really good resources to know if the patient needs somebody other than me, which direction to point them in.